my name is Sarah Schulman, and I'm joined with Jonas, Pict, and we are two of the founders of In With Forward, and we are a social design shop, and we embed ourselves within social service organizations, so big nonprofits who are providing services to people who are living on the margins. And our specialty is really working with folks who are having a hard time, whose outcomes are not where they should be, and who are not experiencing the benefits of a well-functioning welfare state. So we actually have a pretty big ambition as In With Forward, and that is we're trying to turn our social safety nets into trampolines. We really want to enable more people to thrive, to flourish, not just to get by or to survive. And to do that, we have moved all around the world. So we're relatively new to Canada. This is our first couple of years here in this context. But we have worked with all different types of population groups and governments and nonprofits around the world. We've worked around homelessness in the Netherlands. We've worked around social isolation and older people in the UK. We've worked around child protection and foster care in Australia. And over the past couple of years, we've been out in BC working around adults with a cognitive disability, and here in Toronto around homelessness and drug addiction. And it's fair to say that we have a really mixed track record. It is really hard to create systems change and change for people on the ground. And for us, that is the measure of success. Can we actually see people living different kinds of lives? So we're going to tell you a story today about our 10th attempt, I think, to try and create change for folks, and some new hypotheses and hunches about how to get to that change. And it really starts with flipping the order in which we typically make programs and policies for folks on the margins. So typically, people might convene in a conference room, lots of experts, people that have professional titles and degrees who know a lot about drug addiction or homelessness or disability, and they might come together and create a set of frameworks. And those frameworks then might get translated down into RFPs, requests for proposals, that then lots of nonprofits and service delivery organizations apply for, and then they run those programs, they implement them, and hopefully people benefit and are the recipients of those things. And so we're trying to start with people from the ground up, really get to know them in their own contexts and environments, and then develop new practice. So not programs, but practice that actually shifts the dial and creates some sort of behavior change. And then and only then to start to codify that as new policies and new systems. And so we've been applying this kind of different order of program and policy making in British Columbia with three of the province's largest disability service providers. And together they make up about 10% of the budget that British Columbia has for adults with a cognitive disability. So they have some significant leverage. And one of the reasons we started with these three service providers is we thought they were perfectly positioned. They could help us leverage up to the system and start to think about procurement and the policy that might be getting in the way of the lives of people with a disability. But they could also help lever us down to the families and to the folks in communities that are actually experiencing some of the challenges. And so these are our partners. They've been really intrepid along the journey. These are chief executives who have a vested interest in the status quo. All their money comes from the status quo, and yet they were brave enough to say, hey, we actually think the status quo is not good enough, and we're going to dedicate some of our own funding to try and disrupt the system.
Yeah, they were actually one of the reasons why we moved to Canada like 3 years ago. This is the problem statement that we started out with. So we started with a project around social isolation among people with developmental disabilities. Yeah, that's where we started. And this is what that likes. This is what it looks like. This is reality. If you have a developmental disability, autism, Down syndrome, or another kind of developmental disability, and you're 19, you may well end up in a day program like this. And people do the same activities on repeat from their 19th birthday till they're 40 or even older. And it may be a safe environment, and for some people it's comfortable. But it's not about growth or development, and it's certainly not about community inclusion. Yeah. So So some people already mentioned it, like the importance of observational research, and we absolutely agree with that. And so we moved into a social housing complex to really understand people with developmental disabilities, but also their families and community as well. So in this block, there's lots of different people living, immigrants, people with disabilities, we as well for 3 months. And we moved into room 303. And then we get to meet many people, including Umit and Faye. Umit living across the corridor from us with his family, and Faye living by herself with a whole number of different support workers in her life. Yeah. One of the things we learned from talking with them, that people are not so isolated. They've actually got quite a lot of different people in their lives. But the contacts that they have are very, very transactional. People come in, help you put your socks on, maybe put your dinner in the microwave, but they will not stay to have dinner with you. Like, there is lots of contact happening, but there's not a lot of exchange, let alone newness or development. And we had lots of conversations about like people's last good experience or their last time that they did something new. And this is something that Faye mentioned and came up a few times. It's the World Exhibition in 1986. So it's like 30 years ago. It's like the last time some of the people we spoke with had a good experience or learned something new. And yeah, Faye mentioned like as one of the highlights the floating McDonald's on the exhibition. And that's where we thought about, hey, actually the problem looks a little bit different. And we've reframed the problem statement around development and newness. And one reason is also because a lot of the staff that we worked with at that time, they seem to have a very similar experience. Like people doing it as a second or even a third job, working with people in a disability space, and just like no space for doing something new, developing themselves either. And we came up with a whole bunch of different ideas, 6, 7, or 8, and this was one of them, Kudos. It's a learning platform with real-life, community-based experiences. And we were there before Airbnb started to offer it 2 years ago. And this is sort of the what it looked like back then. And since that time, we have spent a lot of time to implement it. And we, of course, realized that it's not just building the platform, but there's a whole lot more to it. And from the beginning, we also included these people from the Ministry of Community Living, CLBC, Community Living BC. So to make them part of the process, and they've been part since that time. So in the room like this here, we were painting a picture of like some of the touch points, user-facing touch points as well as system-facing touch points that we imagined would have to be different, would have to change. And here are some of them. And in fact, since that time, we've implemented all of them. We've taken all of them from idea to reality. They're not all working well, very well yet, but we're still working on some of them with lots of different people. I think we must have like prototyped with over 200-300 people by now. Like, of course, lots of different volunteers for experiences from Japanese culture, language, to molecular biology, to manga, like you name it, and we probably have it in the catalog. But also lots of different people with cognitive disabilities, because the variance between people is just so big. Some people can't use a mobile phone, for example. Other people don't speak. And then there's people who like speak a lot. And so just the difference is very big. So really important to work with many people. And also, we worked with a lot of the staff and civil servants. And what you see here is one of our first real-life learning experiences. And we're not just testing the app on the iPhone here, we're also testing the quality of the learning experience and if learning actually happens, can we see change happening in people? Like, not just do they enjoy this hour. This is Ben. He just went on a botany walk with Faye, who's on the background, the volunteer host. But can Ben actually learn something from this experience? And we're not just prototyping the solution, but also building the team. This is the part of our new Kudos delivery team. And the team is not just delivering Kudos, they're also continuously keeping to prototype it. And then these are some of the things we tested with government folks. So here is like, how do we get people into Kudos? Like, what's the referral pathway that we called nomination? Because we're trying to move away a little bit from the service language, because it's got such a different connotation. And we also realized that like Kudos is a whole new category. Like at the moment, there isn't something like adult learning in the disability space in BC. So in order for, to get funding into Kudos, we'd have to change, we'd have to influence procurement. And that's what we're doing here with somebody from CLBC and somebody from a service agency. And we prototyped several different ways of changing procurement and how something like Kudos could be commissioned. Yeah, so we're testing lots of different things. This is the catalog. So a new tool and a new booking system for volunteers as well as for people with developmental disabilities. The learning experience itself, the request for proposals, and lots of metrics as well. And what you see here is a mock-up of some of the usage statistics that we're getting through the booking system. But we're also combining that with things like this that we call impact stories. So we're asking lots of people around Kudoers, people going on experiences, to report to us where they see any change happening. So we get these stories from people's families, people that they go on experiences with, and then we collect them and then we share them in this Slack channel that we've got here. So it's really about like, do we see change happening? Is this thing working or not? And this is one of those stories. This is Jay. He's one of our Kudoers, and with him is Brad, his worker.
I need something to improve my life. I need something that would challenge my life.
When Jay and I worked on Kudos together, some of the first things we had to work on was just getting there. Some of the locations were in new areas that you weren't familiar with, Jay. So one of the things we practiced with was finding these locations, and just getting there was in itself a great experience of learning how to get around town, how to go to new places, how to use transit and how to use maps to find your way around.
I see myself like being a better person since I joined Kudos. I see myself like being much more friendlier and much more outgoing and happier and able to get around much more easier.
Getting involved in the community isn't a clear, easy thing to do. Like, where do you go? The community is huge. It's also vague. Kudos created a concrete place and people to go and get these experiences. Fulfillment in life isn't something that just comes to you. It's something that you need to discover, something you need to create, and that is something you need to go outside and get into the world to find.
I get anxious being around crowded people when there's a lot of crowds. Nathan, my host, has shown me like what to do, like take these deep breaths, and it's helped me get over it. I think you learn quite a lot from all these different people, and I just have had a great time joining.
Thanks. We've got a series of small documentary clips from a range of different types of people that have used Kudos. So Jay is one of our more communicative and vocal folks. We also work with people that are nonverbal. And so we've had to learn an entirely new way of doing design and design research with people that communicate in the full extent of human emotions and human ways. For us, one of the big lessons for us in the story of Kudos, which is continuously unfolding. This is not a success story. It's a story of a whole range of system-tipping efforts that are happening at the same time to try and enable a different kind of life outcome. So Kudos alone isn't going to cut it. And no single intervention in the social service space will. And so really the question is, how do we create enough of the capacity and the energy to really flip the switch and flip our thinking and flip the ways of working with folks. And it's not just about user-centered design, because one of the things that we learned early on in our research process was that nobody is asking for Kudos. Had we listened exactly to what Faye and Umit and even Jay said early on, we probably wouldn't have gotten to Kudos. We would have gotten to a kind of service that was nice, that took them to the movies or maybe to McDonald's. But part of our methods, we think, is about values. It's a values-led design process, and it's about exposing people to things that they don't even know exists. So how can we shape preferences of people that have lived really closed lives, who haven't seen much of what's available in the world, and so therefore can't ask for it when you ask them? And so the methods that we develop are really specializing in how to work with folks on the margins to provide that exposure so that they can start to raise the bar of their own expectations about what they want for their life or what they think is possible. And we think that that kind of raising the bar of expectations and the poverty of expectations that can exist sometimes in the social service space because there's such resource scarcity is really the broader cultural change that we're trying to see. And so we're really trying to leverage Kudos, not just to scale it as a new service across BC, but also to think about how do we create a lot more things like Kudos. And that really requires designing a whole different function into service delivery organizations, into nonprofits that typically have just specialized in delivering the same consistent service year after year. And so one of the barriers that the service delivery organizations we work with face is that they're just not allowed to spend money on non-delivery. So whereas the corporate sector might spend anywhere from 3% to 20% of their budget a year on R&D, for service providers, they're judged as a charity by how low their administrative costs are. So they have to put all of their money into front-end services rather than to actually developing new types of things. And so we're trying to change that structural problem, but also change the cultural barrier and the talent barrier that exists. Because they've been starved of this kind of function for so long, where do you start? And so we've been starting to prototype a research and development function that sits between multiple service delivery agencies and government, a space where we share staff and where we bring in different types of talent. So not only designers, but really heavy into social psychology and anthropology and a range of fields to help us think differently about the types of services that get offered. And we're working from coast to coast. This is a picture of the work that we're doing here in Toronto at Queen and Bathurst with West Neighborhood House. And how do we bring different sectors together as well? So, this is the homelessness sector, but actually many of the user insights are very familiar in the cognitive disability sector. And so how do we start to bridge those silos that exist between different issue areas as well and create a common social R&D platform both across Canada, but across these different issue areas? Yeah, so exactly. The drop-in center is a very common intervention in older people's services, in disability, in homelessness, and there's generic spaces where people don't get much growth or development. So we think that there's a lot of things that are going to be required that we're going to be building over the next couple of years as we continue to flesh out what this shared social research and development space is. But two of them that we've kind of heard today and that we would love people's thoughts and comments and ideas on is one, we think that we need to create a different platform for data. And we think that a different type of information and intelligence and evidence is required. And so we're working to create an aggregated qualitative data set, taking all of the stories of people like the Fays and the Umits and the Jays of the world, and making sure that they're not just byproducts of our design process, but actually they become ongoing intelligence that policymakers and organizational leaders can use to continuously try new things out. So how we take all of that ethnographic information and make it accessible in a kind of Stats Canada-like platform, but for qualitative research. So we're interested in connecting with policymakers about how to do that. And we also think that there is an entirely new kind of human resources required to drive this kind of work within the nonprofit sector. And so if you are an experienced service designer and you want to contribute to building this kind of embedded space, we would love to talk to you. And with that, we've got a number of resources online. We try and make our process as transparent, including our failures. So do watch some of our videos and reflections, and come find us if you'd like to ask some more questions or get involved. Thanks.